Hi everyone, and welcome to our Ovarian Cancer and Complementary Therapies event. We're really pleased that you could join us all today. My name's Grace Thorner. I'm the Events and Digital Communities Officer here at Target Ovarian Cancer. We have other members of the Supportive Services team at Target with us too. Soraya and Catherine, if you're there, please give us a wave. You might not be able to see everyone on your screen, but please rest assured that we are all here. As I said, we're really excited to have you at today's event. Dr. Nina will lead a presentation full of evidence-based information to help take the confusion out of different types of complementary therapies. We have set aside time at the end of the session for questions and answers, and I will go through in a little more detail about the best ways to interact throughout the session in a second. So, housekeeping. Who can join our session? Anyone affected by ovarian cancer can join this session via Zoom and in the ovarian cancer community. This includes those living with and beyond an ovarian cancer diagnosis, partners, family, and friends. The session will also be attended by some staff members from Target Ovarian Cancer, so it will be a safe and supportive environment. Some of you have submitted questions when you registered for the event, and Dr. Nina will cover some of these within her presentation rather than during the Q&A. But there is also, of course, time for your questions to be asked live if you want to comment them in the chat, and we also have some pre-submitted questions that Dr. Nina will be answering later. Dr. Nina will aim to answer any questions that come up during the session, but it may be that not all questions can be answered. Although we try and keep questions and answers broad so that they are relevant to more attendees, some attendees may choose to ask questions relating to their own experiences. We would like to agree that anything that is shared during the webinar stays in the session. Please do not share details of other people's experiences outside of the session. And if you are a friend or relative of a person with ovarian cancer, please ensure that you have their consent to speak about their experiences before joining any discussions. I will now hand over to Dr. Nina. I hope you will enjoy the session.
Hello, everyone. Welcome to this session, which covers an introduction to integrative oncology in ovarian cancer. So what we're going to cover today is a little bit about integrative oncology and what it is. What does it have to offer you and how can it work in practice? And we'll talk a little bit about the scientific evidence we might have around some specific modalities or treatment approaches in ovarian cancer and how to access support around those. So a little bit about me. I'm a medical doctor with degrees in natural science and medicine from the University of Cambridge. I also have multiple other qualifications in nutrition, integrative medicine, health coaching, yoga and mindfulness, and several others. I'm the co-chair of the British Society for Integrative Oncology with my colleague, consultant clinical oncologist, Dr. Penny Hayoglu, and I also lead and direct Synthesis Clinic. So let's talk about what integrative oncology is. You may or may not have heard it. So integrative oncology or integrative cancer care is integration of evidence-informed conventional treatment with the psychological, nutritional, lifestyle, and evidence-informed complementary therapies to support better quality of life, improve resilience, minimize the side effects of treatment, and of course, support clinical outcomes. So it's really important to realize that integrative oncology is not in any way sidelining conventional treatment. It puts it at the front and center. But we also recognize that just receiving chemotherapy, radiotherapy, surgery, and other treatments makes us have a significant knock to our system, and we need other supportive approaches for us to be able to maintain resilience. Sometimes the side effects of treatment can be quite debilitating. We definitely want to have the best support available for us to be able to tolerate treatment as per our medical team's advice. The two key organizations that we have for professionals within integrative oncology is the BSIO in the UK, and that's the British Society for Integrative Oncology, and SIO in the US. It's an international organization called Society for Integrative Oncology and has a number of different clinicians within that space. So if you do find that maybe a member of your clinical team is interested, or you might want to be an expert patient who's interested in this, then joining some of those organizations can be a really great way of learning more about it. So BSIO is the leading professional organization for integrative oncology in the UK, and our goal is to promote the practice of integrative oncology in cancer care. Now, our vision is that it should be readily accessible to anyone affected by cancer in the UK. And the way we do it is that we aim to improve cancer care by really supporting healthcare professionals, both who work on the NHS, from oncologists, nurses, GPs, allied healthcare professionals, all the way through to people who practice privately, for example, those in nutrition, maybe herbal medicine, massage, etc. We want to support interdisciplinary communication, so that's everybody talking to each other, because funnily enough, that doesn't always happen. And it's really important that we all talk to each other and collaborate so that you, the patient in the middle, don't have to do so much hard work. You don't have to do so much integration. Everybody unites behind the goals that you have. We also aim to provide educational resources with all the up-to-date evidence so that your clinicians can actually understand integrative oncology and are able to support you with that. And of course, we also want to promote the research needed for effective care. So why on earth bother with integrative oncology? Well, I feel that it offers us a sense of agency and empowerment. Certainly feel that way in my clinic, where we're actually supporting resilience versus the space where you get told you have a diagnosis and actually you are hit with, oh my goodness, I've got to go through this whole roller coaster of treatment. And sometimes you just get told to go home and rest, or there's nothing you can do, we're going to take care of it. And I feel that we all have a role to play in our health and well-being, wherever we are in our treatment pathway. So to me, integrative oncology offers us an opportunity to take actions every day that we can do to support ourselves. It also sees the whole person, not just the cancer. And sometimes I know in the medical system, people sometimes feel they're just seeing this diagnosis, is that, whatever it is, stage 4B, FIGO classification, etc., etc. We want to be able to support and see the whole person and their families and their loved ones and support the whole ecosystem to be able to get the best for you. Integrative oncology offers an expanded toolkit. It means we have more things that we can do to appropriately self-manage sometimes when it's simple enough, but also to receive professionally guided support when we really need it, covering the whole spectrum from cancer prevention to living well with cancer. We want to be able to actually use the best of the toolkit, not just medications, but other things that we can do to support ourselves and minimize side effects and minimize what we call polypharmacy, lots and lots of medications, the growing list of medications that all come with their own side effects. We want to have the best of conventional treatment, but also the best supportive treatment as well. And in the US, integrative oncology is really well established, actually. They're both standalone centers for integrative oncology, and they're also integrated into big teaching hospitals. And I've only picked one example here, which is the Memorial Sloan Kettering Center. And you can see they actually integrate things like acupuncture, massage, yoga into the overall treatment plan for their patients. And they talk about the evidence that's involved within it. This is not about throwing anything that can possibly stick at the problem. This is about getting a personalized care plan that's really well evidenced to be able to support you at the right time. And there are lots and lots of other centers, Banner MD Anderson has an integrative center. Most big teaching hospitals will have one. In the UK, we are limited by the fact that we have a public healthcare service, which is fantastic on one hand, but also limiting on the other hand, because we have to distribute resources in a certain way. So that means that it's not very well integrated where we are at. But BSIO, of course, aims to change that. And multidisciplinary care has been recognized as really important. This is a diagram that's actually from a conventional cancer journal that shows you all of the hospital professionals that are involved, gynecological surgeon, oncologist, pathologist, but also, funnily enough, also brings in the nutritionist. Now, what I'd like to also see in here, apart from this, is, of course, the physiotherapist, the exercise rehabilitation specialist, and other people. But they already said that actually more than just a few people are involved in this. And the more people are involved, the more the integrated approach can actually benefit the person. So they feel they're supported from all the different angles, not just looking at one aspect of their care. So what do I feel integrative oncology is or should be? Well, it should be that rational integration of the best of all worlds, right? That's what we are seeking. Should be whole person oriented and address all our needs, physical, emotional, mental, spiritual needs. It should support targeted and personalized medication use where necessary without over-medicalizing everything. And it's about caring for people, not mindless protocols. And you can get all sorts of weird and wonderful protocols on the internet that people have used. And sometimes there's this assumption that because it's helped one person, it's going to help everyone else. And to me, integrative oncology is about seeing the whole person, seeing where they're at that moment in time, and combining the best available research evidence, the person's clinical experience, and also your values. What's important to you need to come into it. And it does need to be intensely personalized because of the safety margins we have with treatments like chemotherapy, for example, as well as targeted therapies. We need to be careful about what we do. So as a starting point, I really want to talk about the 4 foundational pillars, and that's nutrition, physical activity or movement, sleep, and psycho-emotional support. And the reason I start here rather than going straight into the complementary modalities is because to me, anything you do on the complementary side has to land on this solid foundation. And it's really important because that's how we get the best results out of it. Now, we could be here for hours talking about each aspect of this, which of course we don't have the time for. So all I'll do is I'll just pull out a few key points about why this is important, show you a little bit about the evidence. So in nutrition, there's this European Society for Clinical Nutrition and Metabolism called ESPEN, which is really important. And I'd like to highlight a few key things. They suggest that all patients with cancer, including ovarian cancer, should be screened for nutritional risk no matter what happens. And of course, what we sometimes see within the resource-limited NHS setting is you only get support when your BMI is either too high or too low. And actually, we need to pay attention to our nutrition no matter what the BMI, no matter what the weight history is. And we should get personalized assessment and what we call individualized plans. So what's right for you? And the care should support on getting really good nutritional intake. And don't worry about too much about inflammation, hypermetabolic stress. They're all really fancy words. But all it is about supporting you, no matter what your BMI is, no matter what your treatment is, you need individualized care plans that target nutrition. And that support, as I said, may need to include up-to-date biochemistry. What this means is maybe your up-to-date blood results. What is your liver function doing? What are your kidneys doing? What is your phase of treatment? Your nutrition may need to change from, for example, chemotherapy to maintenance therapy with PARP inhibitors. It depends on what your needs are. It might be different around big operative stress. You might need to be able to eat slightly differently around that time. And there are various nutrition professionals who may be involved. Of course, hospital dietitians are important. There's AFN nutritionists that play more of a public health role. And there's one-to-one support with band-registered nutritionists and nutritional therapists as well. And depending on your complexity of your needs and what kind of support you need, you will be involved in at different points. Now, of course, in terms of the NHS, it's important to realize only dietitians tend to have access within the NHS. So the rest of them tend to be available on a private basis. Now, supplements may be appropriate, and we'll talk a little bit about those in the Q&A. But they must be personalized. Okay, I'm not going to discuss them at length here because actually your oncology pharmacist will need to be able to check interaction as well as the person who's recommending them. And it's not about the case of more is better. Throwing lots of supplements at the problem is actually not going to solve any problems. It's going to create some. So it's about actually, what do you need the supplement for? There has to be a defined role for the supplement within your care plan. And then it needs to not interact with your current care or support it in some way. So it's really important to realize this is a very complicated question that generic really doesn't apply here. And some of the evidence around lifestyle is important. So here there was a 2020 research paper that showed that a healthy lifestyle after your diagnosis, no matter what your lifestyle was like before this, in particular stopping smoking and being physically active, can really support improved prognosis. And actually, women who have the highest third of the healthy lifestyle index had significantly better survival, about 40%, which is an incredible difference if you're thinking about it. We would be quite pleased with it in terms of drug difference in treatment. So if nothing else, you can take nothing else away from my presentation. Move your body in any way you like that suits you, that you can manage at the time, and don't smoke. That will already impact your outcome according to the evidence. And it is important that we do pay attention to our physical activity, because it is important in affecting our healthcare related quality of life. That's what HR-QoL stands for on the slide, including improving fatigue and other physical and psychological outcomes. But it is important to work safely. That means that we do want to be able to work with someone who's not your level 2 PT at the gym, right? Who doesn't know anything about ovarian cancer or any cancer. And we want to be able to work with specialists. So it's either physiotherapists or cancer exercise specialists. For example, can rehab trained people who are trained to what's called a level 4 qualification. And that means they know what they're doing. They understand the complications of treatment and what's appropriate for you now. And we also need to be flexible with our physical activity and our movement. You know, what works for us when we are preparing for surgery might be different for after surgery. It might work differently between different chemotherapies even. So be kind and compassionate to yourself, but move in whatever way you can, supported safely by a professional. Sleep is, of course, really, really important, and it gets affected not only by the whole stress of diagnosis and treatment, but also some of the drugs that we get given when we go through chemotherapy. So, for example, we might be able to talk to our teams about trying to keep our steroids as low as possible, enough to provide the treatment cover, but maybe not too much if it's really affecting our sleep. We might want to consider, or at least our GPs might want to consider, things like melatonin, for example, instead of what we call the Z drugs. And there are things like zopiclone and zolpidem that quite often get given to us when we are in hospital, but they are addictive. So therefore their use is quite often minimized, but of course people still need sleep support. There are some really good complementary therapies that have been well evidenced for sleep support, and that's CBTI. So that's available on the NHS, usually via something called Sleep Station. Now, there might be differences about regional access, but it's still worth a try. As well as mindfulness-based therapies, Qigong and acupuncture. They tend to have the most evidence. But yoga, acupressure, massage, and reflexology also have up-and-coming evidence. And what I've shown here, I've put out just one trial that was a yoga for cancer 4-week program that significantly improved sleep quality, and also that grogginess you get in the day when you've had really, really poor sleep, which makes everything so much harder to deal with. Psycho-emotional support is, of course, essential as well. And I feel, and I think it's important for all of us to realize that PTSD, or post-traumatic stress disorder, is not just a diagnosis that can happen when you're in the war zone or when you go through a horrific road traffic accident. It's really important to understand that actually a significant proportion of those who are living with cancer or cancer survivors can have PTSD symptoms. And if you're concerned, please go and see your GP or your medical care team, because it really needs to be treated appropriately. Generic counseling will not work for trauma therapy. Okay, it's really, really important to realize that. And some of us may have struggled with some of those symptoms and have gone to see someone for counseling and said, well, it doesn't work. Well, the reason it wouldn't work is because we need proper trauma therapy when we are struggling with those symptoms. But counseling might be great if you are dealing with anxiety around chemotherapy, for example. It might be really good for contained things like that. And there's multiple different approaches. Mindfulness-based approaches, apart from psychology-based approaches, they have the strongest evidence-based. So it might be mindfulness-based art therapy, MBSR, which is mindfulness-based stress reduction, MBCT, which is the cognitive therapy with mindfulness. So there are different things, and a lot of them are done in groups. They're actually quite accessible online as well. A number of these programs are accessible online. And the evidence shows what meta-analysis means. It's an analysis of lots and lots of papers put together. And these analyses show that there's low anxiety, depression, fatigue, better quality of life, and even something called post-traumatic growth. And that means that actually after a traumatic event like diagnosis and treatment, actually there is some growth, there's some more resilience in the system because of all of these applications of mindfulness, or maybe breath work or yoga or other therapies. So mindfulness-based interventions are really cool, and I know that, of course, they're being supported by target ovarian cancer as well. So Do access those if you feel it will be of benefit to you. There are other things like yoga, Tai Chi, and Qigong, for example, that can also have a significant benefit in managing anxiety and depression. And the Cochrane Review is basically big medical reviews that take lots and lots of papers together again, and then say, okay, do we really want to be doing this? Is it supported by evidence? And in 2017 already, let alone now in 2022, when we have even more evidence, they recommended yoga for supporting healthcare-related quality of life, reducing fatigue, and supporting sleep, as well as managing depression and anxiety, compared to also psychosocial interventions. So just a quick reminder, if you do nothing else, actually, if you learn nothing about complementary therapies at all from this talk, just keep in mind that taking care of those 4 aspects and getting support with those, if you're not sure what to do, is really important. That's where all of the complementary therapies will work much better for you, and your treatment will work much better for you if you're paying attention to these 4 foundations. So let's talk about which professionals might be involved in providing integrative care. So they're medically and non-medically trained professionals. So integrative doctors, like me, for example, with additional training, cancer support may run clinics or maybe provide one-to-one care. They're also, of course, non-medically trained complementary health practitioners or nutrition lifestyle practitioners that have a really broad spectrum of training. And it's really important to realize that even if they're registered with the appropriate professional body, you will need to check their credentials and their experience individually to make sure you're seeing the right person. And they can be private or available via charity support. So, Yes to Life and Pennybourne UK take the integrative approach in general, but specifically for ovarian cancer, of course, Target Ovarian Cancer runs a weekly yoga and relaxation class every Wednesday. And there are other events that you will receive in your email, such as exercise with Can Rehab Specialist, reflexology, mindfulness, etc. So do keep an eye on those, because it's a wonderful free way of accessing this kind of information and care. And there are many, many different therapies that might form a part of your plan. And you might find that one thing suits you more than the other. And actually, it's completely individual. No matter what the evidence says, it's great to have evidence to say that something is effective. But if you hate yoga, trying to make you go to yoga is completely counterproductive. You might enjoy Qigong more, for example. You might want to do something completely different. So please do listen to your body and what your needs are and pick something that suits you. But in general, we can maybe start with mind-body practices. So we talked about mindfulness already. We might talk about yoga, and that might include physical practice, or what's called asana, breath work, which are breathing exercises, Tai Chi and Qigong, which again are another mind-body modality. What I will cover really quickly here, and I'll cover it a little bit later, is that yoga is different to yoga therapy. And yoga therapists undergo hundreds of hours of additional training on top of, say, a 200-hour normal yoga teacher course. So, for example, I am currently training to be a yoga therapist on top of my other qualifications, and we have to do 850 hours of additional training over 2 years to become a yoga therapist, right? Your average yoga teacher in a class will have undergone 200 hours. So you can see that's a massive increase in experience, and they're trained to work with a number of complex medical conditions and medical contraindications. So again, a general yoga class may not be appropriate for someone who's suffering from significant effects of cancer or cancer treatment, and you might want to consider yoga therapy instead. Whole traditional medicine systems are the most well-known are traditional Chinese medicine, or TCM, and that includes Chinese herbal medicine, what CHM stands for, and acupuncture, for example. And acupuncture can be delivered, or you can be registered with 2 main organizations. There are others as well, but British Acupuncture Council, which is the back here, and ATCM, which is the Association for Traditional Chinese Medicine. And ATCM registered both herbalists as well as acupuncturists, and you need to do additional training. So again, in traditional Chinese medicine, training for both acupuncture and herbalism can be between 4 to 6 years. So that's the sort of amount of training that people go through. Now, when people talk about acupuncture, sometimes we get confused. What is acupuncture? I go to my physiotherapist, they do a bit of acupuncture. Well, that's a different kind of acupuncture called medical acupuncture. It really is very much targeted more about pain relief, musculoskeletal symptoms. So chiropractors, physiotherapists, and lots of other professionals within body work, they will usually use medical acupuncture, not TCM, not traditional Chinese medicine acupuncture. So it's not the same approach. They don't look at things in that way. Ayurveda is a traditional Indian medical system, which again has a number of modalities wrapped into it. Herbal medicine, so for example, NIM, the National Institute for Medical Herbalists, that's where you would go to find a medical herbalist to help you with herbal medicine. Naturopathy, there are various organizations, and body-based therapies, all of which have their own professional regulating bodies. And there are many, many, many more that I haven't listed here, because to be honest, I would have to go through about, probably 10, 15 slides just to put them all in bullet points. So find something that works for you. I've just listed the most common things that you might come across when you do some research. And here are some key questions to ask your practitioner. And one is, of course, about the professional training. What professional training have you completed? And which professional body governs your practice? Because you want to know that they are registered with a professional body. Have you worked with a person with a cancer diagnosis before? And how were you able to help? It gives you an idea of their experience, but also what kind of benefits you might expect from undergoing any particular support. And have you received additional training to work with cancer? Now, this varies hugely between different professions and different professional bodies, but it is important that you know whether someone's undergone an additional cancer training course. And if possible, maybe ask them if they're a member of SIO or BSIO. Of course, not everybody will be a member, but we do encourage professionals to join us to be able to support the best practice. And it's really important to also ask some practical questions. If you're undergoing a complementary therapy, for example, or going for a nutrition consultation, you need to outline your support needs and expectations. What do you expect to get out of it? And then you want the practitioner to give you the costs and the timelines for how they're going to support you. So, for example, am I supposed to attend weekly? Am I supposed to attend once a month? What kind of support am I supposed to be expecting? What would the cost for that be? And it's really, really essential that anything given to you orally, any supplementation or herbal medicine, it's absolutely essential that drug, nutrient, herb interactions are checked. And it is absolutely within your right to make sure you go back to your practitioner and say, have you checked my drug interactions? It's really, really important. Because again, people will vary in terms of how careful they are with that. So integrative oncology in practice, what I've flashed up on this slide, I'm not going to go over it in detail, is some of the really common symptoms that people might experience and some of the best evidence modalities within that. So for example, you can see insomnia, we already talked about CBTI, yoga, Tai Chi, for example. So it's well worth keeping an eye on this, and we can even take a picture of that and maybe post that up later, because it's important to understand there's certain things that might be helpful. So acupuncture, for example, can be helpful for a number of things, but it might not be helpful for everything. So it's important to realize that different symptoms and different side effects require a different approach. So key points of safety. And as I said, like with any conventional treatment, when you receive any kind of treatment, you need to assess something called risk-benefit. How risky is this treatment, and what benefits is it going to give me? And is the risk-benefit, is that balance okay for me? And many complementary therapies are really very safe when they're done by a qualified practitioner who knows what they're doing, but not self-administered without guidance. And it's really important to make sure your medical team are aware of any therapies you're undertaking. Now, it's also important to recognize that sometimes you'll go, no, or this doesn't work. It is also up to us to do our own research and decide whether it works or it doesn't. Or if we strongly feel there is a lot of research in this area, because of the talk I've done or something you have read, bring a paper, bring a research paper or some kind of evidence summary into your consultation with you. Advocate for yourself. If you feel something is important to you, it is also important to communicate that back. I can tell you as a medical doctor, I've received 2 hours of nutrition training in my conventional medical training. So we cannot expect doctors to know everything about everything. It's just not going to work. So if there is something you feel is going to be of benefit and you want to take it to your oncology team, but they're not sure, then maybe it's the time to consult a practitioner or drop BSIO a line and saying, is there any evidence for this, for example? Can you provide me with any papers that might be useful? Then we will be able to support you with that. So do remember, we're a professional supporting organization. We're not patient-facing, so we're not able to support the person who is going through cancer treatment will be able to give you evidence to be able to take to your professional team if you need it, for example. So it is absolutely essential that everybody is on the same starting point, really, and that interactions are checked. And it doesn't mean you can't use supplements or herbal medicines, but it is important that we are safety aware. And what we educate oncology professionals about, oncology teams, that actually not offering it or not being open to the discussions, because sometimes, my patients will say, get a flat no. And it's not until I contact someone and maybe provide some evidence and explain what integrative oncology is that someone is a bit more open to this discussion. And what we teach is that we need to be talking about this, because lots of people, of course, will hide it because they're so afraid of the reaction they're going to get from their medical team. But then it opens you to risk, because you're going to find all sorts of information online. And it may be great information from someone who really knows what they're doing, has good qualifications, or maybe someone's personal blog, which is wonderful to talk about their personal experience. But not everything that person does will apply to you. So really do pick your information very carefully, and don't Dr. Google yourself too much. So given a limited amount of time, I'll just focus briefly on these two modalities, and we can briefly discuss others as well. But yoga and acupuncture is what I'm going to talk about. So as we talked about it, yoga teachers who work with cancer, they normally have 200 hours or so, or maybe 300 hours, depending on the program, of normal training. On top of it, they should really have additional cancer training to work with someone with cancer. Yoga therapists already have it incorporating into their training programs. So general yoga class may not be appropriate, and we need to be aiming for those who are already targeted quite specifically. Yoga differs from yoga therapy in a way that you go usually to yoga in a class, whereas yoga therapy is one-to-one or very small group, personalized and adaptive kind of therapy. It assesses you, so not just a person with ovarian cancer or a person who's been through surgery, but actually you. And it starts with quite a lot of assessment. A person will take a very thorough clinical history from you, and then a yoga therapist will maybe ask you to move in a certain way to try and help them understand how you move and how you breathe to create a personalized plan. And in terms of where to find a yoga therapist, I know that Target Ovarian offers a weekly yoga class, but also if you're looking specifically for yoga therapists, then there's the IAYT directory, and that's the International Association for Yoga Therapists. And there are also training institutions who have their own lists of people who graduated from their programs. So in the UK, it's the Minded Institute and British School of Yoga have yoga therapy programs. There are others as well, but they're the two main ones. And then yoga therapy in Europe as well. So why really bother with yoga? So the general evidence in cancer, it says that generally across quite a broad spectrum of cancer types, it helps reduce fatigue, improve quality of life, support better mental health in terms of depression and anxiety, and support sleep quality. So these are some of the benefits that are evidence-based, that are based on multiple studies across multiple cancer types. Now, we need more studies in ovarian cancers quite specifically, because actually there aren't as many done in that as in some of the other cancers. But what we could see was there was a mixed trial with mainly ovarian cancer patients and a few breast cancer patients, where 10 weekly 75-minute restorative yoga classes were provided for patients, and there were significant improvements in depression, anxiety, mental well-being, quality of life, as well as fatigue. So in terms of why bother with yoga or yoga therapy, those are the benefits you might expect. So acupuncture, we discussed that acupuncture, traditional Chinese medicine versus medical acupuncture have completely different approaches. One is very anatomically based, usually done by someone who works with the body in some capacity, and they tend to be more musculoskeletal symptoms and pain targeted. Traditional Chinese medicine, you might feel it's a bit weird when you go and see a TCM practitioner because they ask you to stick your tongue out. But this is how they were diagnosed. Before we had any fancy machines and any fancy blood tests, people have come up with a different way of diagnosing this. And traditional Chinese medicine has thousands of years of use. And so what they do to diagnose someone in terms of their pattern or how they can support them is they will use the clinical history, they will look at the tongue, and they'll also take your pulse to say, okay, this is what's happening with you. And I mentioned the associations previously. Now, it's really important to realize that acupuncture is not a quick fix. You're not going to go for one session and suddenly you're going to get the benefit. Usually, the benefits accumulate over time. And when I refer for acupuncture, I usually would recommend a course of 6 treatments, weekly where possible, or fortnightly if that's not possible. And then by the end of those 6 treatments, that's when we assess benefit. Now, that's not usually where you stop. You might then go on for maintenance treatment, maybe a monthly session, for example. And then you carry on for as long as you feel is beneficial, of course, as long as it's financially feasible as well. And in terms of evidence, the general evidence in cancer across broad range of cancer types shows us that the main benefits for cancer-related fatigue, for supporting sleep, reducing pain, particularly cancer-related pain and surgery-induced pain. It might help support symptoms related to peripheral neuropathy. So CIPN is chemotherapy-induced peripheral neuropathy. Also, constipation you get as a side effect if you're on painkillers, such as morphine, for example. And nausea and vomiting people can get with chemotherapy. So it can be a significant benefit. And there's also something called moxibustion, which is basically a heat therapy that's applied during acupuncture that can potentially provide additional benefit. Now, again, I'm sure you will hear that from me more than once, is that more studies are needed in ovarian cancer. There was a pilot trial that was some improvement in chemo brain during chemotherapy. And there was a small study that showed that actually using ear acupressure treatment, which means pressure on the different points in the body, has actually produced significantly improved sleep. But we need bigger trials. We need to be able to look at ovarian cancer in and of itself rather than as a bunching all the different cancers together, which is beneficial, but I think it's really important to be targeted too. So as a quick summary, integrative oncology is a person-centered integration of evidence-informed conventional treatment with psychological, nutritional, lifestyle and complementary medicine. And it aims to support better quality of life, improve resilience, minimize the side effects of treatment, and improve clinical outcomes. As I've told you by now, BSIO is a leading professional organization, so we support both organizations and professionals in the NHS as well as in private practice. And we want evidence-based, comprehensive, integrative healthcare to be readily accessible to all of you, to anybody affected by cancer in the UK, and ideally their families as well. It's really important to lay your care base onto good nutritional status, movement, sleep, and psychological support. And if you have not been provided with an assessment or support for those, please do seek it, because it is important that you are sitting on solid foundations. And then appropriate use of evidence-informed complementary interventions, such as yoga and acupuncture and massage, there's a number of different things we can highlight, can be of significant benefit in relieving the side effects and improving tolerance of treatment. And support is available through the NHS, but I said it can be limited currently, as well as wonderful charities and private practice. Brilliant. Thank you very much for listening.
That was wonderful. Thank you so much, Dr. Nina. I'm sure we all learned a lot from that, and it was so informative and interesting. So really excited to now move on to the Q&A so we can find out even more. Sure. I think you mentioned, obviously you touched on some touch therapies there. We had one question come in to ask if acupuncture and massage is safe if you're on blood thinners.
Yes, so in acupuncture, they've actually done some studies, and they show that in people on blood thinners, the likelihood of you having what's called moderate bleeding, which is a significant side effect, is 0.003%, so 3 per 1,000 patients, just to give you an idea. So usually what we would say is, it's not that it won't happen, but the likelihood, the risk is very, very low. You do need to let your practitioner know that you are on blood thinners, because they will need to probably choose a thinner needle. They need to be particularly careful about and press harder when they take the needle out. But you know what? The same goes for blood tests, right? If any of you are on blood thinners, you go for a blood test, you probably need to keep your finger on that point for a bit longer than the average person who can run out of the door a bit quicker. So it's about being aware, but it is not unsafe. The risk is very, very low with that. And massage, again, most of the massage you will see is oncology massage, not general massage. You want to be able to see someone who knows what they're doing. Again, if you let your practitioner know, they will make sure that they're using particularly gentle techniques with you. But as long as you're seeing a qualified professional, okay, not someone who's done a weekend course, then I don't have any concerns about it. As I said, it's 0.003% moderate bleeding risk with acupuncture. And that study has been done and actually, I'm just trying to remember now. I'm going to try and see if I can find the number. In over 200,000 patients, right? So massive, massive study, and that's the risk of complications that they found. So I would say it's pretty comparable to you having, a likelihood of moderate bleeding from next time you go and get your blood test taken in the GP surgery.
Brilliant, thank you. I'm now moving on to chemotherapy and complementary therapies. What are your recommendations for neutropenia or low neutrophils? I said that
yes.
correctly.
I know, you're going to love those fancy words, right? Let's make it as complicated as possible. So neutropenia, low neutrophils, I would say that it's, of course, you'll be given conventional treatments for it. So most of you who've had this experience before, you would have been given a GCSF injection. They're called all sorts of things, but little injection to perk your neutrophils up after chemotherapy. And usually you get told to start it at some point after chemotherapy and carry on to perk your neutrophils up. So that's the way we use it conventionally to try and support this. Now, specific advice is way beyond the scope of this because, of course, you need to understand what chemotherapy you're on or what maintenance therapy you're on. So it's way beyond this. But in terms of things we use, so I personally in clinic use herbal medicine for it. I find it's much more effective than most other approaches. Chinese herbal medicine has a good evidence base within that. So there was a recent big review of over 14 randomized controlled trials, so big trials, that concluded that actually has pretty good efficacy and is very safe when it's done by someone who knows what they're doing. Do not get herbs online from random people, please. This is really, really important because like you wouldn't go and get your chemotherapy online from some random person. You wouldn't go to the corner shop for your chemo. So it's the same thing. Please don't get stuff from general stuff online from people who don't know what they're doing. There are reputable practitioners, reputable suppliers, but you do need professional guidance on it, particularly because of those drug-herb interactions. Other things we might use, and again, the evidence is slightly shakier here, but I would say that I tend to find the mistletoe, for example, can be supportive of people's blood counts. And not with everybody, but in a good proportion of our patients, we find that it has a good effect. And that's injectable mistletoe under medical guidance. So those are a couple of things that people find useful. But again, we need more research. It's one of the such common problem, actually. And most of the time we just kind of shrug and go, okay, right, we have to adjust the dose sometimes. So it's important to understand that there is some evidence, particularly for herbal medicine, usually Chinese herbal medicine, and there might be smaller evidence for other interventions, but it is still a very common and very understudied problem in complementary medicine.
Brilliant, thank you. And to kind of lead on from that, what do you think are the best complementary therapies for neuropathy?
Well, I think I'll hopefully have demonstrated that acupuncture is definitely one of those treatments that has been shown to have significant clinical benefit. There are certain things you can do as self-care at home, and I think that's important. There are certain nutrients that might be beneficial, but we're way kind of away from the supplementation side. So the other things you can do for yourself is actually stimulate your own nerve endings. So quite often what people say, just get a soft spiky ball, not a really spiky ball, but a soft one. You can get those things on shops and Amazon, etc. And actually roll them along your hands and your feet. So that sensory stimulation, keeping those nerves alive, can actually also support you. In some therapies, there may be other devices that you can use. We can use cooling sometimes to try and reduce the blood flow of the chemotherapy to extremities, so to hands and feet, for example, to help reduce the toxicity effectively. But acupuncture is personally, I have to say, my favorite and the one that has probably the most solid evidence behind it.
Brilliant, thank you. And then moving on to maintenance therapies, we had a couple of questions come in about supplements. So kind of more a general question here. Is there a role for supplements when on maintenance treatment?
I think there is a role for supplements, but as I've mentioned before, it's really important to understand that it is not about throwing the book at it and seeing what sticks. So what is the role for supplements? What problem are you trying to solve? What are you trying to do? Are you trying to decrease side effects? Are you trying to support outcomes? Are you trying to synergize with your therapy? What is it that you're trying to do? So it's really important that you and your practitioner, because you do absolutely need professional guidance for doing supplementation during treatment. When you're on medication, we always say, go and see someone who knows what they're doing. Because if you do a DIY job and you end up getting, I don't know, herbs and supplements, you don't really know what's appropriate for you, you can end up in trouble. So when I, for example, will give someone a supplement plan, I will want to know their kidney function, their liver function. I want to know what treatment they're on. I'd want to know what's in store for them later on in their treatment phase, as well as what problems are we trying to solve and what their other medical problems might be. Maybe they're diabetic. Maybe they're on other medications that are not oncology medications that we need to consider. So it's quite a complicated question, actually. And this is why I don't answer generic supplement questions, because I will be the annoying person who will say it depends. And it does depend. So supplements can play a role, but please get professional guidance and don't get massive lists of the internet with supplements and medications and try and do it at home.
Great, thank you. So someone has in the chat has mentioned that they're currently on chemo, sleeping 10 hours a night and still tired. They were wondering if this is normal. So maybe could you just reiterate any complementary therapies that you think are particularly helpful for fatigue?
Yes, absolutely. It is normal. So just as a reassurance point, it is normal. And different chemos will kick our bottoms differently, honestly. So I've been through chemotherapy myself for breast cancer. So I can tell you through my first 3 months on one treatment versus my second 3 months on another treatment was completely different, night and day. So it is normal. But I think what I don't like about the prevention of cancer-related fatigue is that advice to go home and rest. Okay, no. Go home and rest will get you into worse fatigue. And we've conclusively proven this in trials now. If you stop moving, you get worse. You don't get better, you get worse. So actually move, whatever it is. Maybe it might be getting up, I don't know, and going to the end of the road and back. Okay, that's enough. If that's what you can tolerate, fine. If you can't even tolerate that, bed yoga, a few stretches. Whatever you can do, any movement has the most solid evidence base in reducing cancer-related fatigue, okay? And I've also flashed up some of the other ones. So we talked a little bit about some of the acupuncture and yoga interventions, for example. But honestly, to me, movement has to take pride of place here because it also supports other things. It's anti-inflammatory. It supports your muscle mass and your bone mass. And we know a number of treatments can affect those things. So start with movement, add on other things as appropriate to try and reduce cancer-related fatigue, and start early and do not go home and rest.
It's really interesting, thank you. We touched on touch therapies earlier, but I think someone in the comments just wanted a little bit more knowledge on massage. So kind of, is this or why is it beneficial after treatment?
Yes, so I think massage has an evidence base, and when we're looking at it, pain is probably where pain and anxiety were the two things that we tend to find can work. It can also be potentially beneficial for neuropathy, but again, you want to find someone who's oncology trained. I wouldn't want anyone who's going through treatment who has significant disease to just go to someone who doesn't know what they're doing. And there are oncology trained massage therapists out there. So in terms of benefits, you know what, actually, if it improves your quality of life, I think that's a significant benefit. And massage has been shown to improve that. But usually most of the evidence lies within pain in particular, and reduction in anxiety, and potential some of the benefits for neuropathy, although again, kind of the evidence can vary depending on what kind of massage, etc.
Brilliant, thank you. We've had another question come in asking about clinical trials and whether there are trials open that people with ovarian cancer can sign up to in order to increase the evidence to support the use of complementary therapy.
Good question. I'm sure there are, but unfortunately, trial registries tend to be quite heavily focused on pharmaceutical options versus complementary therapy options. However, if you are interested in anything like this, then it may be well worth emailing us at BSIO and we can see whether we can connect you with somewhere. On a personal note, at Synthesis, again, that's something we are looking into. So we are looking at running at least small pilot studies before we can get into big funded trials to see if we can support that. But I think the more we, to be honest, as patients make a noise about the fact that we need more evidence and we need more from our care, the more we can support in charities and government bodies being able to raise the money to support these trials. And I think that's really, really important that we advocate for what we need, not just for what's given to us.
Great, thank you. And I think you did touch on this earlier, there being a database, but someone just wanted to know, are there medical integrative professionals with experience of ovarian cancer specifically, and how would we be able to find them?
Good question. That's where we actually at the moment don't have a full-on directory. So you can we hope BSIO at some point will get one together. At the moment, we are an entirely volunteer-based organization that really runs with all of us donating our time. So we're hoping that in time we will have a directory. At the moment, it is literally about doing a search for integrative medicine. I will start with charities. So some of us will sit on the board or support certain charities, for example. That's probably a good place to look, because normally people who are invited to sit on the boards or do some work with charities tend to have an education and grounding in it. But to be honest, we are way behind. I'll be honest with you, behind the US. In the US, you can go and find, say, a naturopathic doctor directory. And naturopathic doctors in the US are medically trained, not just natural therapy trained, whereas naturopaths in the UK, for example, don't have any medical training. So, and unfortunately, at the moment, I would love to be able to point you to an easy directory. We don't have one yet, but we're working on it.
That's something to look forward to. And on that note, I think this is kind of the last question that we have time for in today's session. But just to end on another positive note, looking to the future, are there any developments within the field of complementary therapies that you're particularly excited about?
Oh, it's very hard to pick. What I would say is I think I'm excited about the whole area of integrative oncology in the UK. And I think that's what I would like to point out. I think BSIO has really started flying the flag for us quite strongly. We've got the Integrative Oncology UK 2022 conference coming up in May, where we're having hundreds of professionals across the board from the NHS to private practice coming together. So I'm excited about us being able to actually make that a reality, and more of us connecting and more of us being able to run research in general, because I'm not excited about one specific modality. I can tell you on a daily basis, I use about 6 to 8. In any one plan, I can use 6 different modalities, from nutrition, physical activity, mindfulness, breath work, herbal medicine, maybe, or supplementation and yoga, right? That can be my average plan. And I don't want to pick favorites. I think we just need to advocate more for integrative oncology as part of standard of care. So I would love to be able to conduct, again, even small pilot studies with patients with ovarian cancer on yoga, mindfulness interventions, EFT, other supportive care, and whole package, the actual whole package of integrative care. Because there actually has been a study in the US that shows those advanced gynecological cancer patients who engage in integrative care have better survival. So it's been shown in the US, and I would love to be able to show the same in the UK and show what's achievable, maybe within the NHS setting, maybe not that much, but then how can charities support it? How can private sector support it? How can we all work together to benefit you?
Great, thank you so much, Dr. Nina. So we are now officially at the end of the webinar. Thank you so much. to all of you for joining us. We hope you enjoyed the session and found it helpful. There's just a couple of bits from me before we go. So we will be sending more information about future digital events and a feedback form. We would love to hear what you thought, as it helps to improve our digital events and ensure we are offering the support everyone affected by ovarian cancer needs. If you would like more opportunities to speak to others affected by ovarian cancer and to experience more of our digital events together, we would recommend joining the ovarian cancer community. This is an open and understanding Facebook community for everyone affected by ovarian cancer anywhere in the UK, and there'll be more information on joining that in the follow-up email. Please remember, if you have any further questions or concerns, or would just like to have a chat after this, our support line is available for you to talk to one of our nurses. So please call us on 020 7923 5475. You can also find that number on our website. As Dr. Nina mentioned, we run weekly yoga and relaxations with Can Rehab qualified teacher Claire Beck-Pitt on Wednesdays from 2 to 3. So again, that will be in our follow-up email, and you can also find a link to register on our website. We also have mindfulness and reflexology taster sessions available for you to watch right after this in the ovarian cancer community, should you wish to do so. So that is everything from me. All that's left to say is a massive thank you to Dr. Nina for such a great session, and for all of you for coming and making it such a wonderful event. We hope to see you all again soon and that you enjoy your day. Bye, everyone.